Hi there, everybody. My name is Dr. Brian Langlois. I'm the medical director here at the Pet Pantry in Lancaster County, and I do want to thank you for bringing your cat in to be spayed or neutered with us today. You will be getting some discharge instructions in a sheet that will be going home with you, but while you're waiting, I did want to just go over some important things regarding the discharge and post-op recovery of your cat as they recover from the spay or neuter procedure. The first thing to be aware of is that they are probably going to be a little bit groggy, a little bit out of it for the remainder of the day. That's normal due to the injectable anesthetics and pain medications that we do give them when they are undergoing the spay or neuter procedure. So they are going to be able to walk, however, they are probably going to be a little stumbly, so it is best to maybe keep them in a quiet room overnight. Definitely try to watch them if they're going around stairs, make sure they can go up and down stairs okay. We don't want them falling or anything like that. If you do have other cats in your home, it is really a good idea to keep this cat that has just undergone surgery separate from your others, at least for overnight. This gives that cat a chance to fully recover from the surgery, groom any weird smells from the pantry and the hospital environment off themselves, and it'll make it much easier for your other cats to kind of re-recognize that cat after you bring them home. The following morning, it should be fine to go ahead and reintroduce them. You can offer them a small amount of food and water when you get them home, usually about a half hour after you get them home, just to allow them to settle from the car ride. If they want to eat, great. If they don't worry about it so much. Some cats just prefer to sleep the rest of the evening. But if you do notice by the following evening they're not eating or drinking, certainly give us or your veterinarian a call. We do want to, check them to make sure that everything's okay. You're going to notice either a small incision on the midline of the abdomen for females and right over the scrotum for males, and that is where we do either the spay or the neuter procedure. For females, all of our stitches are dissolvable and they're internal, so there's going to be no stitches or staples that need to come out. A little bit of swelling, a little bit of bruising is normal in that area on the female, so don't be alarmed by that. If you see a lot of swelling or bruising that continues to get bigger and bigger, certainly give us a call and let us know. We may just want to check it back to make sure it's not anything to worry about. With the boys, we do leave the incision on the scrotum open, so don't be surprised if you see a little bit of an open incision there. That usually seals down within a day, and you may notice a little bit of swelling in the scrotal area that will last for about 5 to 7 days. Doesn't happen in every male cat, but we do see it from time to time, and it is normal. Again, if you do notice a lot of swelling or discharge coming from those areas, certainly give us a call. We may want to check to make sure that everything's okay. You don't want to bathe your cat. Most cats don't see the humor in baths anyway, but if you do have a cat that happens to like water or likes being bathed, you really do want to not bathe them for about 5 to 7 days, and that just allows the incision sites to heal down fairly well. If you have a kitten or a cat that is really rambunctious or crazy, try to keep them a little bit quieter, at least for a couple of days. That will just kind of help everything heal down very nicely. I do realize that with some cats that's practically impossible, but we do ask that you please try to do it. The final thing, well, two final things that I'm going to mention are, one, they did receive an injection of an anti-inflammatory pain medication that will last for about the next 2 days. That usually is enough for them, but if you do notice that they appear to be really uncomfortable, painful, kind of hunching over, not wanting to do stuff, certainly let us know. We can give them some other pain medication as well. And the final thing I'm going to talk about is regards to licking. A lot of people have questions, do they need cones, things like that, and the answer is usually no. 98% or so of the cats that we do here usually do not require any kind of cone or thing to stop them from licking. As the incision heals a little bit, it is going to itch a touch, so a little bit of licking here and there is perfectly normal. Don't worry about that. But if your cat is constantly going after stuff, then you certainly do want to consider, potentially having a cone for them or something along those lines. So please just remember some of those important discharge instructions. They are, again, on your sheet as far as that goes. And, I am going to state that if you do have any further questions, you certainly can give me a call here at the pantry at 717-219-4032. Again, 717-219-4032. Be more than happy to answer any of your questions. And again, thank you for bringing your cat in for spay or neuter today, and try to enjoy them because it's probably the calmest you may see them in a while.